Okay, question one. This is really, really common. How do I know if my baby is getting enough milk? Oh my goodness.
Yes, very common question. When we're bottle feeding, we can measure the bottle, right, everyone? When we're breastfeeding, we cannot measure it. There's the unknown of how much did baby transfer at the breast. Before the milk is in, there's the stage of colostrum, as many of you know. That's before the milk is in. It's perfectly designed for baby, and it's smaller amounts. So baby does need to eat frequently, but you may not hear the swallows. You may be concerned because baby's still seeming hungry or very sleepy, and you didn't really hear any swallows, which is kind of the main thing we're looking at in those early days. Can I hear it? With the colostrum stage, we're looking for a swallow about every 6 to 8 sucks. You may hear a k. Okay, so in the colostrum stage, we can't measure intake just like throughout our whole journey. So we begin from the beginning watching baby's output. So instead of measuring intake, we're watching output. So baby's pee and poop count. In your hospital, there's guidelines there to know. I could go over that as well. But we watch that pee and poop count, which is basically how many days old baby is times 1. Day 1, 1 pee, 1 poop. Day 2, 2 pees, 2 poops, and so on until day 6. It's 6 pees and 4 poops for that first couple of months we're looking for daily. You will also be having weight checks to assure baby's getting enough in regard to weight gain. Baby's behavior between feedings. We're going to feed on demand to make sure baby is getting enough, and we're going to watch those other signs. Now, once the milk starts to come in, we have the fullness and engorgement. When you feel that fullness before feeding baby, you're going to kind of take note of that. When baby's nursing, you will hear k, k. You will hear 1 suck per swallow. You're going to also watch for baby's up and down. It's called a jaw drop or chin drop. As baby is sucking, you're going to see a long jaw motion where they drop their jaw. That is a sign of transfer, and you can hear the swallow. We're going to feed, and then after that side, you're going to feel your breast. Take note if it feels softer. That's a good sign. Some moms can tell that, some not, but we're going to look more for swallows and baby's behavior. But you can feel after. Burp, you feel this breast, it feels pretty full. You hear gulping swallows. You might have to burp throughout the feeding, which is a whole nother thing, but lots of burping and keeping baby awake. And then after, how do they behave? They're relaxed, they feed well. Then we're looking at the frequency between feedings. If baby's feeding every 30 minutes and seeming hungry, showing signs that they're still hungry, we would either go back to breastfeeding, and if concern on them getting enough, that's where we maybe seek out help if there's further concern.
Wow, that's so helpful.
Yeah. Yeah, and I also like moms to know before the milk's in, they're working hard at the colostrum stage, watching signs they're getting enough, but all that demand plays a huge purpose on bringing the milk in. So do your best to wake baby at least 8 times in 24 hours, which would be at least every 3 hours. And then once the milk is in, we're going to feed on demand as well, but looking for that fullness, hearing swallows, and then watching baby's output and weight gain.
Wow, that's so important to know. Like so many moms ask that, is my, let's say, baby sleeping for more than 2-3 hours, should I wake a baby or should I not wake a baby?
The
That
standard
reference is so important.
Yes, and the standard recommendation that is that baby feeds the 8 times in 24 hours. You'll hear 8 to 12. That's the American Pediatric recommendation. They have a small stomach. They digest that milk. So despite what grandma or caregivers want to tell moms, it's very important we make sure baby feeds typically every 3 hours or 8 times a day for the first 2 weeks of life. And then at 2 weeks old, if they're back to birth weight, they can then start doing a longer stretch of such as 4 hours at night. So we keep baby on the 3 hours during the day and then let baby sleep a little longer. And then we work from there on continuing to help baby in their circadian rhythm and sleeping longer. But in those early weeks, we are definitely assuring they wake up and help them. If they're, you guys know, babies are growing rapidly in that first month of life, especially throughout the journey, the first 6 months. But with that really active brain growth, they go into deep sleep mode and their brain may not wake them up well to nurse and to eat. That's where we do little baby sit-ups, put baby skin to skin. We could do a whole thing on waking a sleeping baby because that is like the story of everyone's lives in those early weeks. It is very important to wake them.
It really is. That's awesome.
Yeah.